This patient here has been treatment planned for a full upper and full lower immediate denture. At this point here, we were taking vertical dimension of occlusion for the upper denture, which is now in place, and patient is back a month or two later for the lower procedure. At this point, we are going to remove the remaining lower teeth, most of which are either cariously or periodontally involved. Some of the teeth, especially the canines, lower right and left, could have been used as abutments for a partial lower, but patient's insurance will not cover that, and patient is ready to have this procedure done. At this point, we're trying to luxate the canine, but more of the movement is being expressed onto the lateral. Actually, the elevator is reversed to provide luxation to the lateral, but that wasn't the original purpose of the luxation. To loosen it, I wanted to loosen the canine. Tooth is loose, and now here's a little dangerous situation here where the patient picked up the tooth for us, and we're trying to grab it and it slips. We push the patient head immediately over to the right so that the tooth falls down into the buccal area rather than being swallowed. And we're in the process now of figuring out what we're going to do with this stubborn canine. That's the one I was most concerned about. And starting to lay more of a periosteal flap, and the more I look at it, the more I realize that just flapping and getting a good purchase with forceps on this tooth is not going to be enough. So actually at this point the video is missing. We did lay a flap. We used a surgical burr to trough around the mesial distal, and quite quickly got the tooth out, and now we're closing up the site of that flap with a suture. I could have been grabbing the needle a little bit further away from the flap so that I had a longer point of needle to go through that tissue. I had a little bit of backtracking to do to get that needle out and through the lingual, but now finally we're getting that flap closed back up. That flap was only on the mesial aspect, not the distal aspect. As a general dentist, I generally try to avoid flaps as much as possible, but in this case here, we were in the middle of treatment and elected to do that. So after we get this closed up, we're going to get the rest of the teeth removed. And the patient, at this point, we gave the option to stop at this point and come back and do the left side at another day because it's a separate block anesthesia. Here's after we've gotten the first two. I said, let's start with the most difficult one and let's see how we do with that. And after this point, patient was ready to continue. So now here we go with, actually, we've removed the teeth, and now we're placing the immediate full lower denture in place, checking the occlusion, telling the patient to leave the denture in to control swelling, gave him ice packs, and we'll not do much adjustment until we see him next week. And that's it for now.